Thank you, Mr. Speaker. I thank the gentleman for yielding. I thank him for his leadership and that of the whole Rules Committee on having to field some really strange notions masquerading as proposals to improve the lives of the American people. And we see a lot of that these days. But this one on the floor today really takes the cake because it is essentially pull the plug on the Affordable Care Act. And while it says that they want to delay the cancellations that the insurance companies have written to policyholders, the bill does not mandate. So this is a conversation. It's not an action, but it does violence to the bill in other ways. That idea that it was helping consumers was sort of the Trojan horse whose underbelly is poisonous in terms of the health and well-being of the American people. Mr. Speaker, I rise to come to the floor on the rule because I think it's really important for members to vote against the rule as a point of fairness. If we reject this rule and allow the Rules Committee to come back to the floor with an opportunity for there to be a Democratic alternative, that would be fair. And what we would do in the vote on the previous question, which I urge people to vote no on, would be able to vote yes or consider voting yes on a bill that does exactly what consumers need in terms of this cancellation area. First of all, it would say that there would be a real delay for 1 year for the implementation in terms of the individual policy holders. That's just this piece of the bill that is the question, individual policy. 95% of the American people, as has been said, who have policies that they like can keep them. It's this 5%, and that's a lot of people. I don't want to minimize that, but nonetheless, it's a discrete market. So let's address that discrete market, and in our previous question, we bring up a bill that addresses that discrete market, not only by enabling them to hold their policies for a year, but by requiring that the insurance companies must tell people, not that you're canceled, but these, and we want to sign you up again at a higher cost. Instead, insurance companies would be obliged to tell people what their options are. What their options are under the Affordable Care Act in terms of having no lifetime limits on their policies, no annual limits on their policies, no pre-existing condition increasing the cost of their policy or preventing them from holding their policy should they become sick. A. B, it would also make sure that the insurance companies tell people what their options are in the exchanges, or that they may qualify for a subsidy, that they may compete in that marketplace. The insurance companies are competing. This is the free market, this exchange. They are competing for their policy, and therefore that has already lowered cost to consumers. So they may have a better policy with better benefits at a lower cost, and if they qualify, get a subsidy to do it. In addition to that, it's really important in every respect that in everything we do, not only just for this individual marketplace, for people to understand the benefits of the Affordable Care Act that are available to them. I mentioned no pre-existing condition, no annual limits, no lifetime limits, but also that already for the past over 1 year, young people can be on their parents. Over 3 million people have benefited in that regard. Tens of millions of seniors have benefited from the free prevention checkup, mammograms, whatever kinds of things, prevention and wellness exams, free, no copay, no deductible. Already seniors are experiencing lowering costs for their prescription drugs because of the Affordable Care Act. Already small children cannot be discriminated against, nor their families, in seeking insurance because they have a pre-existing condition. Imagine a child born with a defect in anything for life. They have a pre-existing condition which will cost them dearly in terms of premiums if they can even get insurance, and then it would be with limits. Not so. That's all changed. That's why on this Upton bill, which, as I said, is it not only does bad things to the Affordable Care Act in terms of disrupting the risk pools, it tries to masquerade as something that does something positive, which it does not. And that is why the Upton bill is opposed by a broad coalition of groups: the American Heart Association, the American Diabetes Association, the American Cancer Society Action Network, National Partnership for Women and Families, Paralyzed Veterans of America. Anyone with a pre-existing medical, 100 million people are in families with people with pre-existing medical conditions. All of them benefit. The stories are so glorious and so beautiful about what a difference the Affordable Care Act has made for families, especially those with small children or those with pre-existing conditions, and to seniors. And again, being a woman is no longer a pre-existing medical condition. So this is politics. It's not about policy. It isn't any attempt to improve the Affordable Care Act. One way to improve it, though, is what we have in our previous question. Give the state commissioners, state insurance commissioners, the authority, all of them. Some of them have it, but ensure that all of them have the authority to investigate and act upon rate increases, as well as the nature of these letters that were sent out without the integrity that they should have had. Again, we require that they also, in these letters, that the insurance companies make sure that people know what their opportunities are. So what we are proposing today really does make a difference. In fact, we wanted to get this requirement of the insurance commissioners into the underlying bill. And then we said, okay, we'll do that as an improvement. Today is a day that we can do that by voting no on this rule and enabling us to bring a bill to the floor that would do that. With that, Mr. Speaker, I urge our colleagues to support the Affordable Care Act, support what it does for America's families, stand with those who fought for Social Security, for Medicare, affordable care for all Americans, because these are three pillars of equal weight in terms of the economic and health security of the American people. They honor the vows of our founders for life, a healthier life, liberty, the liberty to pursue your happiness so that you're not job-locked or constrained by a policy, but free to follow passion, to be self-employed, to start a business, to change jobs, to be entrepreneurial. Life, liberty, pursuit of happiness. Vote no on the rule. With that, I yield back the balance of my time.